Haemolytic disease of the fetus and newborn is a serious condition that can lead to fetal anemia and associated complications. Red blood antibodies usually are related to rhesus disease. In rhesus disease, a rhesus-negative mother comes in contact with rhesus-positive blood of a fetus, for example, in the first pregnancy, and develops antibodies against the rhesus-positive trait. And if in a subsequent pregnancy, this rhesus-negative mother with antibodies against the rhesus-positive trait has a child that is rhesus-positive, then these antibodies cross the placenta and can destroy the red blood cells. The result is severe anemia in the fetus. In order to prevent that HDFN is overlooked, it is important to do a testing for red blood cell antibodies. If such a test is positive, then it needs to be specified which kind of antibodies are present in the woman. And if then a woman is recognized as being at risk for HDFN, she needs to be monitored. The titer of the potential antibodies needs to be monitored, but most of all, it is important to monitor the fetus if there are signs or symptoms for fetal anemia. And fortunately, this is possible through a non-invasive test. The Doppler sonography of the middle cerebral artery can be used to determine if there is anemia in the fetus or not. The diagnosis of HDFN means that the woman is at risk for losing her pregnancy or giving birth to a child that is at high risk of having a severe disease. And that comes with the fact that the red blood cell antibodies destroy the red blood cells of the fetus and of the newborn, and the fetus gets anemic. It develops anemia. And if this anemia is not treated, then the fetus will either die in utero, or if it's not recognized before or shortly after birth, it cannot be treated appropriately after birth and can suffer severe problems and potentially death. If a woman is at risk for HDFN, it is important that the baby is regularly monitored. That means she needs to be seen by a maternal fetal medicine specialist that does Doppler sonography to watch out for signs of fetal anemia. And this can be easily done by doing a Doppler sonography of the middle cerebral artery. And if the maximum velocity is increased, that means that the baby is at risk or having severe anemia. And in that case, the baby can be treated by intrauterine blood transfusion, and the anemia can be balanced out by giving additional blood to the fetus. It is very important that this potentially lethal condition, lethal for the fetus and or the newborn, is treated in a center that has expertise with this condition. That means a center that is specialized in the diagnosis and treatment of HDFN. That means there need to be hematologists that look at the titers of the red blood cell antibodies if present. There need to be maternal fetal medicine specialists who do the Doppler sonography and, if needed, do the intrauterine therapy, the intrauterine transfusions, and also after birth there need to be neonatologists who are trained in that disease in order to do a potential exchange transfusion. That means an interdisciplinary team needs to be there that has experience and routine in treating this disease. If a fetus with HDFN is born, it needs to be monitored to see how the hemoglobin levels are and how they developed. And in some cases, it is necessary to do phototherapy in order to ameliorate the symptoms of the fetal blood demise. And in some cases, it is necessary to do exchange blood transfusion in the newborn. And this needs to be assessed by a neonatologist and treated by a neonatologist-based team that have experience with that condition. The potential long-term effect of HDFN on the newborn are dependent on also when the baby is born, because in some cases it's necessary to do an early delivery, and then prognosis is also determined by prematurity. However, it's very important that the disease is recognized, diagnosed, and treated early, because that is the most important factor that can alter the fetal prognosis. The good news is that if diagnosis is early and appropriate and treatment is done if necessary, then in 95% of the cases, the outcome of the baby is favorable.